Hi, you guys. It's Timika Chambers here with Fulfill Your Divine Purpose, Facebook page that is dedicated to heal from the inside out. Because often when we've been through potentially traumatic experiences, we look for external support or external healing, what we think will heal us. Bandages is what I call them. And as you know, band-aids fall off. They're only limited in duration. So no matter what you choose on the outside, it will not give you the healing that you need from the inside out. And so we're about healing from the inside out, achieving and sustaining optimal health. You do not have to be a statistic just because a family member or someone you know is struggling or dealing with managing a health condition doesn't mean you have to. There's a lot of fear out there believing that because someone else went through something that I'm going to go through it too. And I had a family history. I have a family history of heart disease, strokes, diabetes, cancer, you name it, it's out there. And it was when I was a young nurse or in my 20s, I decided that I didn't want to be, and I didn't know it at the time, but I didn't want to be a statistic. Just because others were having that or dealing with that condition, I didn't want to deal with it. Instead of just succumbing to my family history, I said, no, I'm going to make some changes. And when I found out my triglycerides were over 150, when I found out my cholesterol was up, I made those dietary lifestyle changes to help bring my cholesterol down to a consistent below 50 number. And as you know, you want to keep triglycerides down under 150. And so I made those changes because I believe that I deserve better. I deserve to be happy. I deserve joy. And I decided that as a young age that I didn't want my experiences to define me in a negative way. Do you understand? Because I believe that life experiences help build character. They help to build on the next experience. Whatever you learn from that, you will eventually apply in a different experience, in a different scenario. So it's all about achieving, achieving, and sustaining optimal health, mind, body, and spirit. And so the other thing is fulfilling your divine purpose. I believe that everybody has a purpose here in life. Everybody is on a journey of self-actualization, what Maslow talked about, his hierarchy of needs. We are here to become the highest version of ourselves. And so I believe that we all have gifts and talents: dancing, singing, building, construction, teaching, speaking, writing, whatever it may be that builds joy from your heart, that creates joy in your life. That is what you are here to do. And some of us, it may take a while to get there. Others, we know exactly what we want to do. We come out of our the womb knowing, and we do it. And for many of us, we experience potentially traumatic experience. We experience the projection of pain from others. And unfortunately, sometimes we identify with that pain. And we go through life struggling with our identity, with life, our life's meaning, our purpose. And so it's all about fulfilling your divine purpose is just understanding that no matter what you've gone through, you are here for a purpose. Your spirit has not changed. Your bodily outside form may have been tampered with, but inside is a jewel, a spirit that is here and has conviction and knows what will bring you joy. And so I've been starting my Facebook group, trying to talk about things that affect the heart on Mondays. Monday, we're talking about, what can potentially stop us with our purpose. And I said potentially. Wednesdays, I like to share healthy tips, recipes. and Fridays just to give a little bit more motivation, empowerment, education prior to the weekend, because Sundays are typically that day that of great inspiration, of rest, and really reflecting on what your week is going, what you experienced throughout the week. I don't say that Sunday is the only day you reflect, but Sunday has always been a great day of reflection for me, just to restart my week and what did I do that I could have done better, right? And so Mondays, we're talking heart to heart, and we're talking about heart disease. If any of you guys know, I've been a nurse for over 20 years, trained nurse. I have a bachelor's in nursing as well as a master's as a nurse educator. And so I've spent my time in and out of the hospital. I started out as a candy striper in the hospital as a student, and went on to become a student nurse, a grad nurse, and a registered nurse. And I over the years, I just saw so many people coming in and out of the hospital struggling with their health. But underneath those diagnoses, heart disease, kidney disease, pancreatic disease, I saw emotional trauma, emotional issues, pain that had not been dealt with. And so I don't know if you know, but heart disease is the leading cause of death in men and women. And one thing, I don't know if you knew this, but the common symptoms like the heaviness of the chest, the jaw pain, the left arm pain, often women do not experience that. My women out there, we don't experience that. I remember working for a disease management company where I called people all around the United States, and one lady confirmed it when she said, I was having severe back pain. And I wasn't sure what that was, but something told me to go to the emergency room, and sure enough, she was having a heart attack. And did you know that majority of the heart attacks, they say, according to science, and I put some research information in the information here, that many of the heart attacks will happen on Mondays. Cardiovascular events is what they call them. And so Les Brown talked about it. Dr. Miles Monroe talked about it. Both of them talked about how the cemetery is the richest place in the world, because you have so many people that are dying off early with so many gifts and talents, yet unrealized. Just a few more data that I have, that one person every 36 seconds dies of a cardiovascular event. 659,000 people die from heart disease each year. 363 billion was spent in 2019. Billions of dollars go to what I want to emphasize: chronic preventative health conditions. Preventative. That's what I want you to get, not the chronic part. Preventative. Because often what I would tell my students, what I would tell my patients and clients is that I tell you stuff to inform you. I don't tell you this information to scare you, but to inform you, just as so I tell you that you're not a statistic, that you don't have to be one. That blocked arteries or coronary heart disease killed 360,900 people in 2019. And I do want to go back to 363 billion. That was in the year of 2016 and 17. But there's data out there that says billions of dollars are spent on just chronic preventative conditions, including diabetes, etc. And so there are things that you can do to help reduce your risk of heart disease. And we have to understand that heart disease is not just about diet. You know, so many people get fixated on diet and eating and limitations and struggling. I was never a big fan of diets. Never. It was all about moderation for me. That I learned that I lost 50 pounds, that I reduced my cholesterol down, not because of a diet, because it was about self-control. And just knowing, okay, am I full? That's enough. I don't need to eat anymore. Right? Paying attention to my body, listening to my body. What symptoms am I getting? And so in 2018, I believe, I went ahead and tried a plant-based diet. I bought this book and tried a diet. And the very things that I knew, and even more I found out during it, is that you're constantly watching, okay, am I eating enough of this? Okay, not, okay, wait a minute, I need to follow this for lunch and dinner. And that's not how we are supposed to live, right? We're not living to eat. We eat to live. And I know you've heard that before. And that's the premise, is that we're not supposed to be here focusing on pinch by pinch by pinch calories to get ourselves at a certain weight, to get our cholesterol down. It's about listening to your body, listening to your mind, listening to your heart, listening to what's going on. And so even though I say that, there are foods out there that have been shown to be superfoods to help with your heart, like walnuts, like blueberries, fruits, blueberries, apples, and getting that fiber off your fruits and vegetables. Vegetables are always good. Broccoli, Brussels sprouts, lean meats. Salmon is great. Omega-3 fatty acids that help to thin your blood, right? And so the smoother your blood flows through your arteries, the better. Anything that you can do there to boost your HDL, which is your good cholesterol, you should know what that is. The LDL is your lousy cholesterol. And that's the one that gets in there and clog up your vessels. Triglycerides, you get that from eating a lot of cakes and pies and other foods, extra calories, and that can make your blood really sticky. And so blood needs to flow through those vessels or tunnels throughout your body so they can properly nourish your eyes, your brain, your heart itself. We talked about coronary events. Coronary arteries go through from your heart, in your heart. And so you want to help keep those clear by, omega-3 increasing your good fats versus your not so good fats. The other thing I wanted to point out, again, it's not just food, but also to our thoughts. What we're doing is that Monday mornings, there's some discussion behind that. Why people have heart attacks or cardiovascular events on Monday mornings is because they're waking up, they're thinking about their week, they're thinking about going to a job that they don't too much care for. Just to share my story, I used to work when I worked in the hospital. And I knew I didn't want to continue to see people. I wanted to affect people, their lives on a different way. I didn't think that people should be struggling with their health. And so every time I would go walk through the hospital doors, there would be this mounting sadness that would come over me. And I knew I had to leave. I wanted to be on the opposite side. And it took me a little while to get there, but I wanted to be on the side to help people take better care of their health, to educate people, to inspire people, to empower them with the information and tools to help them. And so that's where I am now. That's my path now as an educator, as a speaker, as a writer. And so I want you to think about not only the foods that you're eating, but I want you to think about your mental health. I want you to think about, am I where I want to be? Because although you're going through that experience, what are you learning from that experience? Are you learning what you want and what you don't want? Because along our path, I believe that's part of it. It's knowing not only what you want, but what you don't want. And to really hone in, what do you want? I want my holidays, weekends, nights off. I want to wear what I wanted to wear. I wanted to affect people's lives in a way that was more empowering and not so much with the politics of regulating what I say and what I do. I want to spend time with my children and cook and eat at regular times. So what do you want out of life? What do you want? Because this life, we don't know when we're gone, we're no longer going to be here. So what is it that you're supposed to do while you are here? What brings desire? What wakes you up when you see it and you feel like your heart is ringing because you see it? What resonates with you? Because again, it's not about just food, what foods you're eating. It's about what you're constantly taking in, that energy, that message that can be so life draining, or it can edify you and build you up each and every day. Even if you're not making the impact that you want to make, the work that you are doing. is making you sing from the inside out. So I encourage you this Monday to not stress about looking at your life, but what have you learned about yourself? What do you really want out of life? And what are those limitation barriers that are that you need to demystify, that are preventing you from having the life that you want? This is Timika Chambers with Fulfill Your Divine Purpose, all about fulfilling your purpose, healing from the inside out, removing those barriers that tell you you are your experiences because you are not, and achieving and sustaining optimal health, because your body is the vehicle for your message.